Can I first of all say how truly sorry I am for all of those families who have lost ones due to COVID-19, and I know all deputies share that sentiment, and also to send our very best wishes to those who are ill right now. And as many deputies have said, it's great to see Dr. Tony Holohan back at his desk. It gives us confidence. But I have to say I'm annoyed by an earlier comment. This is not a Chinese virus. It's a virus. A virus knows no borders. And those comments, I think, are inappropriate in this House or anywhere else. Now, I briefly want to say we had the discussion earlier about whether we should meet here today. And yes, there are arguments on both sides. And I think, apart from the huge issues of accountability and transparency, I think during a time of crisis, people need to see that systems work. So much is uncertain, they like to see some certainty. And I think the democratic system is an important element here. And can I thank the staff in Leinster House for facilitating us here today, because they are facilitating the democratic system, and their role today is just as important as ours. The issues that I specifically want to raise revolve around healthcare in congregated settings and healthcare and care in the home. Now, regarding care in the home, I want, like others, to speak of home care staff, which is a vital link in dealing with this crisis. Many of those staff now, their hours are down from 15, 20 hours a week to 3 or 4, and they are not eligible for any COVID-related payments because they were not working full-time. Now, I understand that at lunchtime today, the HSE issued a circular committing to pay home care providers at the level of March up to the 19th of April. And that's good, but it's a temporary measure. Other workers have 3 months certainty. Home care workers need it as well. And I'd ask the Minister if they would put contingency measures in place to support this often invisible army of home care workers. They're critical now, and they will be critical in the future. They need more certainty with regard to their incomes and around issues like personal protective equipment and other emergency supports, because at the end of the day, they are the people who will help to keep many older, vulnerable people out of hospital. Another issue is around family carers. For example, if you're caring for a family member and you work maybe 10, 15 hours a week, those carers cannot now cease working because they're afraid they'll bring the virus home and receive a COVID payment. If, on the other hand, workers who have young children can make that choice and receive a COVID payment. Now, I fully support the decision in regard to childcare, but I believe that the same support needs to be in place for family carers, because once again they're protecting the elderly and helping keep people out of hospital. My second concern is around congregated settings, care homes, respite centres, refugee centres. We have already seen how crucial it is that these settings are safe, both for those who live there and those who work there. And, of course, we know it's critical for the wider community, because every person who becomes ill and needs a hospital bed means there's fewer available. Now, this is both a private and a public health issue, and I think we need to learn from our mistakes. And regarding refugee centres, I have serious concerns around around the fact that best practice is not being followed. And if you look at national media and social media, they have reported significant inadequacies in certain centres, indeed, in particular, one of my own constituency. The department recommended that these centres provide hand sanitisers, latex gloves. My information is it's not happening. And also, residents need to be able to eat in their rooms or eat meals. Meal times need to be staggered. Again, I'm not sure this is happening. Finally, like many others, can I express my personal gratitude to those on the front line. They are our safety net and we're truly grateful to them. Thank you.
Thanks, Deputy.